future, how should we think about the future? And then specifically, what sort of things are those of you who are more knowledgeable than the rest of us thinking about possible outcomes, and what sort of preparations are being done for those outcomes, and how should we respond to that? That's a lot of questions. And Jeff, I don't know if you would mind kind of starting there.
No, I think that's good. I think a couple things that we've had to our advantage here is that we are in an area where the uptake of this has been quite a bit slower. And so, we've had an advantage that New York City and that Seattle and New Orleans have not had nearly as much of, and that's time to plan and prepare really well over the past 3 weeks. And I've been very encouraged by the two competing health systems in Peoria have been working really well together at the highest level, but also just with very open communication. But within our own health system, I think that the plans, the level of planning, not only for what we can do with limited testing, that's not a health system problem, that's a national shortage problem of some of the testing supplies. But also, are we going to have enough beds? Are we going to have enough ventilators? Are we going to have enough personal protective equipment for the patients that we are expecting will continue to grow in Central Illinois? But also then what happens when people go home? Are we going to be able to care for people at home? We're really encouraged today that the Four Points Sheridan will be a place for people who can't go home, whether they're homeless or maybe they live with immunocompromised patients, that there's a place for people like that who will be able to go. And that hotel in Peoria is going to be opened up with estimates about 40 to 50 on each side for males and females. And for children to be able to go if there's not a place. So there's been a lot of time and a lot of planning that's gone in. And I think that our CEO made a comment the other day, Dr. Keith Knapp, that I thought was really good, is that as much as we possibly can plan for something like this in good conscience, I feel like we've done the preparation that we could possibly do. And I think that, OSF would be able to say the same thing. Yeah.
That's great.
I'm encouraged by that, actually.
Mm-hmm. Good. What about there's obviously a lot of different we see a lot of different modeling and a lot of different heart responses to that modeling. In your role as a doctor and a shepherd, elder pastor, how are you shepherding people who are feeling anxious right now? And sorry, Jeff, that's another follow-up question for you.
Yeah, no, that's fine. You asked about authority, Kevin, and a verse that I keep going back to is just that verse from 2 Timothy chapter 1, about reminding you to fan into flame the gift of God, which is in you through the laying on of my hands. For God gave us a spirit, not of fear, but of power and love and of self-control. And I think that is just all the things that you mentioned in the first part of this talk on authority are the things that we should be going to for our anxiety, not any kind of modeling, because God would command us not to be anxious, even if this is going to be 10 times worse than it's going to be. And so I just think that the answer for anxiety should not be primarily in a number. But I think secondarily, I think we do have modeling, and as time goes on, this is part of the reason some of these things change as we get more and more information on how this virus has acted in other places, not only internationally, but in the United States, that those models become a little bit more and more accurate. And so it does appear that in the state of Illinois, that the apex of this, as far as the rate of deaths per day, is expected to peak somewhere around the 20th of April, maybe a day or two after that. And then we've been quite a bit behind here in Central Illinois, so maybe another 5 to 10 days after that are kind of some of the very rough, crude projections that we are focusing on. So seeing that, but just remember that would be the apex, and then after that, hopefully continuing to see the downtrend after that. But that doesn't mean that all the social distancing and everything would be over at that time. That just means that that's when we need to really stay the course to be able to see those numbers to continue to drop. Now, again, those are based on the best information we have, but those are really crude guesses and crude estimates. Yeah.
Isaiah 44, one of the essential attributes of God is his ability to, in contrast to false gods, to know and declare the future. He says, thus says the Lord, the King of Israel, and his Redeemer, the Lord of hosts. I'm the first and the last. Besides me, there's no God. Who is like me? Let him proclaim it. Let him declare and set it before me. Since I appointed an ancient people, let them declare what is to come and what will happen. And then in a couple of chapters earlier in Isaiah 41, he talks about how he's revealed things of old. And so, the great thing is we have everything we need to know about the future right now, in our understanding it through God's special revelation of his Son, Jesus Christ, and our sufficiency and hope in him. As we've been dealing with anxiety about the future with our kids too, I think what we're experiencing about the lack of ability to tell them the future is what we're all going through in Central Illinois and around the world right now. I don't know, Diane, Aaron, did you guys have any other thoughts about preparations right now that the community is making?
I think Jeff really covered it. I kind of think about this preparation time as preparing for the worst, but we're hoping that it won't be the worst. But I also have been encouraged by the work that's been done to, as much as we can, prepare for the worst case scenario, but hope and pray that's not what we confront.
I am noticing, and this is my opinion, but I would like maybe the other doctors to comment on this, because maybe it's just a personal thing, but I would like to see the healthcare community helping the public stratify themselves a little bit. I'm seeing, very healthy, fit 25-year-olds extremely anxious and concerned. And then I ran into a patient of mine who's very high risk in front of the milk at the grocery store, so I'm thinking there could be some public service here in that regard. And I think that might be a good community thing, or maybe, that's just something that's more personal involved preparedness, and we'll get to that. But
yeah.
Well, go ahead, Jeff.
I was just going to say, I communication of good information is hard, right? And, one particular news source may have an editorial that catches a person's mind. And, I've had plenty of patients who tell me that this is not worse than the flu and that I'm worried about things I shouldn't be worried about. And that's very unfortunate, because that's not true. And so unfortunately, those conflicting voices that we talked about in the first segment can really influence people. I feel like the state public health department and our local leadership, when they have had opportunities, when I've seen them on the news, have really tried to warn people to stay home. Maybe not as much of encouraging the younger people, but of fear. But we do know that you ask about projections, 50% of the people who get this will have mild to no symptoms. Another 30% of people they will feel sick, but probably will not need health care or hospitalization. It's that last 20% that we're really worried about that may need hospitalization, and then even a smaller percentage of those people would need, an ICU or intensive care or mechanical ventilation. And so, the majority of people, that's 80% of the people who are going to do fine without a need for hospitalization. And like Diane said, the younger that you are, the healthier you are, the less likely this is to affect you. Although, unfortunately, we have seen a few younger individuals who have been sicker than you would expect. But yeah, typically it is older patients with diabetes, heart disease, lung issues, and chronic illness, immunosuppression, that are the people who really have had the worst outcomes.